Hi guys, how you doing? In this video, let's look at three things which you may not initially expect after you've been through your whole all-on-4 experience. My name's Gus. I'm a cosmetic and implant dentist based near London in the UK, and we do a whole load of what we call full arch treatments. So when someone's got no teeth or all their teeth are really bad, we change it to having a full set of teeth on dental implants. And typically we use a process similar to the all-on-4 developed by the Nobel Biocare brand. Now, I've done a whole bunch of videos about this in the past, and a lot of people contact me saying, hey, look, I've had this treatment and I wasn't expecting this, and is this normal? And even some of my patients, after going through the whole process, no matter in how much detail I explain everything at the outset, there is sometimes things which they have ended up with which they didn't expect at the outset. So let's go through the three biggest ones now. Number one is lip support. Okay, so this is actually a really big deal because if you lose all of your teeth, you lose all of your support. That causes a collapse from the sides and from the front of your lips and cheeks. And that collapse, we need to maintain it. We need to give support so that your whole facial profile doesn't change. Now, this is actually quite a tricky thing to do because if you look at all of these cases, these are the people who've had all-on-4 treatment. One thing you might notice is that their teeth are all tipped forward. Now, this typically happens when you've got gum disease. You lose bone support around teeth. The teeth start tipping forward. They go. You start getting gaps between your teeth, and everything tips forward. That over time changes your facial support. So you can have artificially more supported lips. Now, some people like that, some people don't like it. When I typically do an all-on-4 treatment, I'll set the initial teeth up to where I think they can go. Okay, or where I think they should have been before gum disease. And that's typically bringing them in a little bit. Now, they are just temporary teeth, and we have got flexibility. When we go to the finals, we can change it because by bringing the teeth back and in, we're going to lose gum support or lip support, and that's going to cause this facial collapse. So a lot of people don't mind it. They like having the good looking set of teeth, but some people say, actually, you know what, my lips have sunk in, my lips look thin now, and I really wasn't expecting this. So this isn't normally a big deal because it's much easier to take teeth which are in on the temporaries and gently bring them out, providing that lip support and still maintaining excellent aesthetics. Now, another thing related to this is some people who are showing a lot of gum when they smile, like this case here. When we do the treatment, we have to trim away a lot of bone at the top, okay, because the junction between natural gum and the all-on-4 prosthetics, the all-on-4 teeth, has to be completely hidden by the lip. Otherwise, everyone knows you've had something done, and that's not a great look. So when we do this bone reduction, we have to be very careful because we don't want to take too much off because then it means we have to use very short implants, and all-on-4 doesn't typically like short implants if we can get away with it. But one thing that sometimes happens is when patients smile, their top lip tightens up and it sits up above the all-on-4. So to avoid this, we actually need to take even more bone off. Okay, so it's all in the planning. These kind of cases, you can kind of see what's happening at the outset during the treatment planning stages. I can guess where this is, for which people this is going to happen. It doesn't happen to everyone. It happens to a few people. Now, when you have your all-on-4 done on the day, you will probably think, oh my God, my mouth's full, this is really thick. That's because the temporaries are always a little bit thick. They're made from plastic, and plastic gets its strength from thickness. When we get to the final ones are much thinner typically because they're made from a metal framework. Or you can have them made from zirconia or a whole bunch of other materials, but I tend to prefer the metal framework with acrylic wraps on them. And I've done a video in the past to explain why I like that. And although this is a lot thinner, what patients sometimes feel is the screw holes at the back. So the screw holes can be just an unevenness, a little lump on the back of the kind of the all-on-4. And again, it's just one of those niggling things which people may not have expected, but ends up that they can feel. Now, I've had one patient who this really annoyed a lot. But in general, people do realise that, you know, what it is and the function it has and the limitations, because we have to always realise that this treatment, although it looks amazing on photos, you can see a massive difference before and after, there's things about the feeling of the treatment which nobody can actually explain to you. Nobody can explain how something is going to feel. You have to experience that yourself. So in order to experience it for yourself, you have to actually go through the treatment, which is why even with the best consent processes and explaining everything in a lot of detail, it's impossible for me or anyone to explain to their patient what this treatment will actually feel like. In the vast majority of cases, we can say it is life-changing. It's always a positive outcome. But we have to also be aware that there are some things that we just can't predict. And as a clinician, these are relatively small, but they may be a really big deal for some patients. Okay, so I don't want to scare you off having this kind of treatment. I do these videos so that you can learn from the experience which I have talking to patients who have had this treatment, and I speak to quite a lot of patients who we've done this treatment for, and out of all of the possible bad things that can happen, these are probably the biggest ones. Actually, you know what? I'm going to throw in another one. Sometimes to help cleaning, we'll actually leave a little gap between the teeth and the gums themselves. If we do this, it makes it amazingly easy to clean the all-on-4. But the downside is air can escape out of there. So when you're talking, it feels like your top lip is jumping up and down. The bottom actually doesn't matter. We can leave a gap at the bottom, it's easy to clean, but it's not going to affect anything. But the top one can affect speech. So often changing the position of the teeth will change your speech. You'll have to relearn how to talk, and sometimes you'll get this kind of bubbling feeling at the top there. If that bubbling feeling is there, that is quite easy to fix. It means that we just need to add a bit more material to the fit surface of the bridge, and that will seal everything up. It makes it a bit more tricky to clean, but it depends on how big a deal that is for you. Okay, so I hope you found this video useful. If you've got any questions, comments, leave them below. If you liked it, give it a thumbs up. If you didn't like it, give it a thumbs down. And I will see you in my next video, which hopefully will be next week. All right, take care.